What do lymphoma lymph node biopsy results mean? Imagine getting a report that can tell you if your lymph nodes are affected by lymphoma and what that really means for your health. When doctors suspect lymphoma, they often perform a lymph node biopsy. This involves removing a small piece of a lymph node, usually about the size of a pea or a grape, to look at it under a microscope. The results from this test are crucial because they help determine if lymphoma is present, what type it is, and how aggressive it might be. If the biopsy shows lymphoma cells, it confirms that cancerous lymphocytes are inside the lymph node. This is called a positive result. If no lymphoma cells are found, the result is negative, meaning the lymph node does not contain cancer at that time. But sometimes, the biopsy might be inconclusive if the sample is too small or not representative, and additional testing might be needed. The biopsy also helps distinguish between different kinds of lymphoma. The two main categories are non-Hodgkin lymphoma and Hodgkin lymphoma. Within these, there are many subtypes, like follicular lymphoma or diffuse large B-cell lymphoma. The pathologist looks at the size, shape, and arrangement of the cells to identify these subtypes. This is important because different types respond differently to treatments. Another key aspect is the grade or aggressiveness of the lymphoma. Larger, fast-dividing cells usually indicate a high-grade, aggressive lymphoma that may need more intensive treatment. Smaller, slower-growing cells suggest a low-grade lymphoma, which might progress more slowly. The extent of lymph node involvement is also described in the report, indicating how much of the node is replaced by cancer cells, which can give clues about how advanced the disease is. Pathologists may also look for genetic abnormalities or specific protein markers in the cells. For example, certain gene rearrangements like BCL2 or MYC can influence prognosis and help guide treatment choices. Sometimes, the biopsy results are combined with imaging tests like PET scans to see if the lymphoma has spread or to monitor how well treatment is working. If lymphoma persists after treatment, it might mean the disease is resistant, and doctors may need to adjust the therapy. Overall, biopsy results are like a detailed map that shows exactly what kind of lymphoma you have, how aggressive it is, and what features might influence your treatment plan. Remember, each person's situation is unique. It's essential to discuss your results thoroughly with your healthcare team, who can interpret the findings in the context of your symptoms, imaging, and overall health. They will help you understand what the results mean for your prognosis and the best options for your care. Always seek personalized medical advice and follow your doctor's guidance for the most accurate and effective treatment.